is connected in such a way it affects the senses and how we perceive and read situations and interactions. This is known as autism.
So we're often too quick to make judgments on what we perceive to be happening when children behave in a way that draws some attention. But when a young person with autism is struggling to cope with the world, the last thing they need is our criticism. It is estimated that approximately 1% of the global population is autistic. Now, currently, autism affects 1 in every 68 individuals and is about 4.5 times more common amongst boys, where it affects 1 in 42, than among girls, where it affects 1 in 189. Now, autism spectrum disorders, or ASD as we call it, is reported to occur in all racial, ethnic, and socioeconomic groups. World Autism Awareness Day is an internationally recognized day and is celebrated annually on the 2nd of April. Adopted by the United Nations in December 2007, the day focuses on providing equal opportunities to people with autism and seeks to raise awareness of the autism spectrum disorders and improve the lives of those currently living with autism. So our topic for today is autism. And to help us unpack this, we have an expert panel comprised of a child psychiatrist, an occupational therapist, a school principal of specialized education on autism, an adult self-advocate, a representative of Autism South Africa, and a mother of a child with autism. Now, as always, we invite you to please be part of this show by asking the panel some questions or simply just sharing your views with us. And in that case, the number to call is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk or simply just interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show ahead, coming to you just after a short break. I'm Dr. Sello Mutaung, and this is Health Talk.
At MedShield Medical Scheme, we don't just talk health, we do health. SMS MedShield to 33023 or talk to your broker to get your kind of care.
No. Yes. Yes.
Sports Live every Saturday and Sunday at 7:30 p.m.
Autism is a treatable medical condition, and there are some children who can recover from autism. Not every child will recover, but if the children receive specialized and appropriate educational intervention, they will and can become functional and independent members of society. David was diagnosed at a very early age with severe autism. Because he received the right medical and educational intervention, able to communicate his needs. The Star Academy provides a unique service to children in South Africa because our program is based on ABA. ABA stands for Applied Behavior Analysis and is the one statistically proven tool and education program used for children with autism that has been documented and proven to be successful.
I saw him today in his session where he's learning about money, and hopefully one day when he's 16, 17 he can go into a store and purchase and have independent living, because that's really what we're working towards. This is a child where I was told when he received the diagnosis he will never toilet train, he will never speak verbally. He's retarded, take out an insurance policy, and my immediate family were telling us about the Solomon Seagull and that we should put him in an institution. So if you see the session with David, although he's not a kid that's necessarily going to recover, you do see a functional boy who we have been able to live with, who's now able to actually communicate with us. Like, he can tell us which sweet he wants, to where we could have maybe taken that child and left him in an institution.
My message to other parents who receive an autism diagnosis for their child would be to school yourself as much as possible. Read as much as you can about autism because the condition is treatable. There is help out there. When your child is diagnosed with autism, you think that you are the only family whose child has ever been diagnosed with autism. The fear element is great. It can be so very devastating. But the moment you empower yourself with knowledge to help your child, the moment you start seeing progress in your child, you will feel better and your child will make progress.
All right, so let's learn more about this condition called autism or autism spectrum disorders, or just ASD for short. And to help me do this, it's a great pleasure to welcome our special guest today. First up is Dr. Helen Clark. Now, Dr. Clark is the head of child psychiatry, psychiatry, yes, at Chris Hani Baragwanath Hospital. Welcome to Health Talk once more.
Thank you.
Right, and in the middle, we have Mary Mweketsi. Mary Mweketsi is from Autism South Africa, and she's the Regional Development Officer for the Limpopo and Mpumalanga provinces. Welcome to Health Talk.
Thank you, Doctor.
Right, and last but not least is Aretha Kausele, who is herself a mother of a child with autism, but she's a center coordinator for the NEL's Center for Autism in South Africa. Welcome to Health Talk, Aretha.
Thank you, Doctor.
Right, perhaps Doctor, let's start with you and just kind of unpack this. What is autism? What are we talking about? We hear about autism, we hear about ASD, as we've said. What is this?
We very much moved in our way of looking at autism from autism as a very specific diagnosis of disorders and delays of speech, social interaction, and repetitive movements, to a much broader diagnosis, a kind of a broader presentation of symptoms related to social communication, repetitive behaviors, repetitive thought patterns, where you don't have to have a significant number of symptoms, where you can have small numbers of symptoms or more severe aggregation of symptoms on a spectrum. And this is broader, it encompasses a lot more children, and diagnoses such as Asperger's, which was previously diagnosed as a different condition, are all now accumulated within the diagnosis of autism spectrum disorder. And it is a much broader and encompasses just a whole lot more children.
I had a question earlier. I mean, is this a mental disorder? Is it a medical condition? I mean, I see that you talk about spectrum and a whole spectrum of symptoms, as it were.
Yes.
Is there a typical picture, perhaps?
It is diagnosed as a psychiatric disorder.
Right.
And it is a psychiatric disorder because it interferes with functioning. It is a neurodevelopmental condition. In that way, it is a medical condition. It is integral to the brain. It is not something that is caused by anything you eat or drink or anything that's in the environment. You are programmed to develop this condition. It develops with you as your brain develops. It's integral to you, and it presents through your interaction with your world and your experience of self as you grow. And as it does that, it interferes with your interaction with your world.
Okay, we're going to come back to that because I'd like us to go into a little more detail because it's not just about some abnormal behavior of a child, because I mean children can behave in all different ways. But let's just invite some comment from Mary. Mary, Autism South Africa. Firstly, tell us about what this organization does.
Autism South Africa is a national organization that looks out for issues of children and adults on the autism spectrum. We function or we work in 8 provinces of the country. In our work, we do help parents, especially when they still struggle with trying to get the diagnosis of the child, to try and point them to the right direction where they can go for help. We always help when the child has already been diagnosed and the parent does not know where to take the child, maybe for educational placement. We come in because we work closely, especially in Gauteng province, we work closely with the Department of Education. So we are able to point the parents to the appropriate district where they need to go and apply for placement for the children. We also run support groups in the provinces where we work. We run support groups because we realize that after the diagnosis, in many cases, parents don't even understand. When the doctor says to them, your child has got autism, they don't actually really understand what is the meaning of this diagnosis. So in the support groups, we work with parents. The parents come together, and it's a safe place for parents because the parents can just talk about their feelings. They can talk about what they go through without being judged or criticized by other people, because we still struggle with autism, because autism, immediately your child is diagnosed, people tend to think that your child has got demons, so there's
still lots of stigma around the condition.
Yes, there's still quite a lot of stigma around autism.
Let's invite some comment from Aritha. Aritha, yes. Any else Center for Autism South Africa? Just tell us a little bit about that.
Basically, where we come in is after the child has been formally diagnosed, we help the parents, we empower them by teaching them there's some educational tools that we use where they become their children's teacher, because that's what we believe in. A child will learn from a parent more than they will ever learn from a stranger. So that's what we mainly focus on. So we use these programs, and because it helps empower the parents, then they are able to teach other family members, and then it continues on.
Okay. We know Ernie Els to be one of the greatest South African golfers. Yeah. So what's the link?
We are part of his foundation because Ernie has a son with autism. In 2009, they formed a foundation which mainly focused on a lot of different things, but autism formed part of that. So this center that we work in Joburg was formed in 2011, and that's basically what we do.
Right. So any interaction with Autism South Africa, because it sounds like there's some commonality in terms of what you know, the actions or the programs that you have there?
Yes, we work hand in hand with Autism South Africa because we're in the same building.
Yeah.
They would refer parents to our center, and that's when we start taking them through the process and of teaching them and helping as well with some of the key elements where we have we have a support group that we have on it's the first Friday of every month. It's usually with parents that are already part of our center, so we just get to discuss and we see everything. Yeah.
Just one last question to you, Mary. I hear you talk about support, you know, to parents who have children who are already diagnosed. But in terms of awareness generally in the community, do you not do some sort of awareness programs as well? Because I would imagine the level of awareness is not as great as we would like it to be.
As Autism South Africa, we don't only focus on the 2nd of April or the month of April. We do awareness nearly every day. The only thing is that it is not covered like we